Hi, I'm Brooke, and I'm going to be talking to you about the standard of care. So first, what is the standard of care? Well, doctors and physicians have a duty to care for their patient and provide them adequate medical attention and medical assessment regardless of their age, weight, gender, ethnicity, and we're all entitled to being treated with this standard of care. Now, when these standards are breached, it often results in negligence claims, ones of which we went over a bunch in class. I wanted, however, shed light on a different truth, and that being the standard of care between men and women, specifically when talking about prescription medication. So, throughout history, the male body has been considered the standard or the norm, especially when we talk about prescription medication. The majority of prescription trials and clinical trials have been done on men and only men because women have fluctuating hormones, which has skewed results. So medical professionals and experts have decided, let's just leave women out of them so that we can have a proper standard of care. So there's a model of health, and the model is a man. And this one-size-fits-all healthcare system mentality is problematic for several reasons. As I was saying before, prescriptions. Women are 70% of all chronic pain patients, yet only 20% of them actually get prescribed painkiller prescription medication, which is completely skewed, right? One example I have is this woman who was being discharged from the hospital after a miscarriage was only prescribed 800 milligrams of Tylenol, while a man being discharged from the same hospital after a vasectomy procedure was prescribed oxycodone to take as needed. Both equally painful procedures, one getting the proper pain medication needed, and the other getting an over-the-counter drug, essentially. Staying on the topic of inequality of standard of care post-op, well, 5 years after having a heart attack, almost 50% of women die compared to 36% of men. Women are more likely than men to be susceptible to certain diseases such as orthopedic injuries, autoimmune disorders such as lupus, and even diseases like chronic obstructive pulmonary disease. Yet these conditions go unrecognized and misdiagnosed until almost too late of stages. Women are also 20% more likely to have adverse reactions to prescription medication. And I'm not going to get into completely, but also the lack of research being done for menstrual and hormonal health for women, including PMS and hot flashes and menopause, is just a cause for concern, to say the least. And while the standard of care for women is overturning, the healthcare system is still far from where it should be to providing proper standard of care to all women. Thank you.